My name is McQuade. This is Tim Sakhuja, Yaanik, Desai, and Mike Vido. And today we will be presenting to you our design for a nanoplatform for cancer therapy and imaging. Now, some of you know cancer is second only to heart disease as a major killer of Americans every year. However, even though this is a very devastating disease, physicians still have a number of weapons that they can use in this war against the emperor of all maladies, as one famous medical historian once put it. For instance, one therapy that most of you have probably heard of is chemotherapy. However, the problem with most chemotherapy treatments is that you're essentially pumping toxic chemicals into a patient's bloodstream and hoping that it kills the tumor before it actually kills the patient. Now, another treatment modality which does not have the same problem, toxicity, is radiation therapy. In radiation therapy, if you have a very localized tumor, for instance, located in a single organ or discrete tumors in multiple organs, you can use a concentrated beam of high-energy electrons to target the tumor and only the tumor, thereby leaving the rest of the patient's body spared from the radiation's harmful effects. However, there are still two challenges which physicians face in designing a radiation treatment. The first of these is that in order to precisely target this radiation beam, you also need very precise imaging data. However, even with modern technologies, the actual extents of the tumor are not necessarily that easily discernible. However, if a physician injects a contrast agent into the patient and it localizes at the tumor, then you can see the extents of the tumor very clearly defined. In our case, we chose to use iron oxide nanoparticles, which at a very low concentration are able to give very crisp contrast under MRI imaging. The second challenge that physicians face is actually targeting the tumor specifically, because even though you can tune the size of the radiation beam down, there's still some radiation which actually leaks out and starts to damage healthy tissue. Ideally, we would like to tune down the amount of radiation that patients receive while still maintaining a deadly dose to the tumor itself. And this is possible if physicians administer some sort of radiosensitizing agent to the patient, which in our case is gold nanoparticles. Whenever you irradiate gold nanoparticles with ionizing radiation, they give off high-energy electrons which damage the tumor but never make it outside to damage the healthy tissue. Now, to explain how we incorporated these into our design, I'll hand the magic wand off to Tim.
All right. So what our system does is it combines these two different types of nanoparticles we talked about. The gold, the iron oxide for their contrast abilities, and the gold for their therapeutic enhancement effects. What we do is we combine these two particles into one convenient Micelle package for easy delivery into the body. So what a Micelle is, it's a spherical aggregate of polymeric molecules with a dense core consisting of our two different types of nanoparticles. So the idea is you inject this Micelle into a cancer patient's bloodstream. You then take a snapshot of the cancer patient's tumor. And you see that because of the contrast properties of the iron oxide, you get a very clear picture of where the tumor is located in the body. And you can use this information to pinpoint your radiation beams to hit precisely the location of the tumor while sparing the surrounding tissue, which is great. And also, because you have all this gold packed densely in the tumor, for a given dose of radiation, you're able to do a lot more damage to the tumor cells specifically. So you're going to kill many more cancer cells for a given dose of radiation and get a lot more bang for your buck. Okay, so what we did over the last semester was we iterated through many different Micelle compositions until we settled upon our finalized design. So our optimal Micelles had a mean diameter of 100 nanometers, and this is to ensure ideal biodistribution properties. Because Micelles make really convenient platforms for drug delivery in our case, because they deliver both of our products simultaneously to our target and keep them there long enough for them to do their effects. Now, once we're done with them, we don't want these hanging around in the body forever. So the body can begin to degrade these biodegradable Micelles, releasing these really tiny particles into the bloodstream where they're quickly cleared through the kidneys, which is great. So we take a closer look at this Micelle. We can see the individual nanoparticle components. So here we have the 12 nanometer iron oxide component that we made ourselves. So we synthesized these. And if you take a closer look towards the center, you see a bunch of very densely packed, much smaller 1.9 nanometer gold nanoparticles, which we also made ourselves. And basically to make these Micelles, what we did is you mix these two nanoparticles together along with a polymer that forms a coat, and you shake them up very vigorously with a sonicator. It's a lot like making salad dressing, actually, except at the end of the day, you're left with this solution of Micelle rather than a nice vinaigrette for your salad. So this is what our micelles look like in solution here. And this is probably about 2 doses. So we settled on a ratio of gold to iron oxide in our micelles at 4:1 because we want to be able to pack a lot of gold in there because our primary concern is getting this therapeutic enhancement effect. But we wanted to have enough iron oxide to see the contrast effect. And this 4:1 ratio of gold to iron allowed us to do both. It was a nice balance. Okay, so now we've shown you, how we arrived at our finalized design. So now we're going to take you through and prove that our design does exactly what we want it to do. It allows us to visualize tumors, and it allows us to get this therapeutic enhancement effect in radiation therapy. So to do that, I'll pass it off to Yaanik.
Thank you, Tim. So remember that one of our design goals was to package our micelles with iron oxide nanoparticles in order to provide effective contrast in MR imaging. So when a patient comes into the clinic and we inject them with our micelles, does our product provide the contrast necessary to image a tumor? Well, in order to answer that question, the parameter that you need to look at is called T2 relaxation. And you want that number to be above 100 per millimolar second. When it's above 100, you get really good contrast in MR. For example, here's a picture of a patient who has a tumor in his liver, and you can see that the borders of the tumor are very clearly delineated because the iron oxide nanoparticles are providing the contrast. So we aimed to provide a T2 relaxation above 100 per millimolar second, and we actually delivered a value nearly 3 times as high at 268.6 millimolar per second. So the answer to that question is yes. Our product is able to image a tumor. So to show the contrast effects of our micelles in action, we actually took them over to the med school, and we took a snapshot of our micelles in an MRI machine. Now you can see, as you increase the contrast of our micelles, the image is getting darker and darker, which means that the iron oxide is providing the contrast necessary. And it actually does so at very low concentrations, which is crucial. In fact, our micelles are able to provide contrast that is more than 20 times as sensitive as the contrast abilities that you get if you were to take a CAT scan of a tumor. So we are able to image a tumor. But the next thing that we wanted to test, before we propose delivering our micelles into a patient, we want to make sure that they're not inherently toxic. We measured this via a cell viability assay, and we saw a less than 8% drop in viability. So we could confidently say that our product is not inherently toxic. So now Mike is going to talk about our crucial final product design.
So thanks, Yaanik. So thus far, we've talked about how our product was able to fulfill our goals in imaging tumors. Now let's talk about killing cancer cells. To measure our product's ability to enhance current radiation therapies, we performed the gamma H2AX assay. This assay allows us to visualize DNA damage sites within cells. DNA damage is one of the ways by which ionizing radiation causes cell death. So I'm going to show you a series of images, and what you're looking for are red dots. And these red dots show the DNA damage locations, and the more DNA damage that has occurred, the more red dots will be apparent, and the more cell death that will occur. So the first image we have here is an image of cells that have received no radiation dose. And as you can see, there are no dots enclosed in these nuclei. You can compare that image to this image here, which shows a sample of cells that have been treated with radiation but have not received our micelles. And you can see there are localized areas where DNA damage has occurred. Compare that then with our combined treatment, where we combine our micelles with radiation. And you can see a huge increase in the amount of DNA damage. In fact, it's a 2.2-fold increase. So what does this 2.2-fold increase actually mean? Well, if a patient comes in to receive radiation treatment, we can, in fact, dial down the radiation that the patient has to receive by a factor of 2. And this speaks to exactly what Casey was mentioning earlier. If we can dial down the radiation by such a large factor, we can, in fact, reduce the overall radiation the patient experiences while still receiving this high dose in the localized tumor area. So in fact, our product can be used to treat cancer cells in radiation therapies. To give you an idea of the cost of our product, we compared it to another more recent product on the market, Avastin, a monoclonal antibody treatment, and these run about $2,000 per dose. Our cost for manufacturing our product was dramatically less. In fact, it's dramatically less. Yes, as you can see. So thus far, we've proved that our product we've proved our product's effects in cells. Moving forward, if our product is to eventually receive FDA approval and can be used with patients, we need to transition into mouse studies where we can continue to show our product's effects. Additionally, we need to scale up our product's manufacturing process for large-scale production. However, we are very pleased to say that our product can both be used to image cancer cells and kill cancer cells. These are a few of our references, and as we conclude our presentation, we'd like to thank the Bioengineering Department, the senior design faculty, Dr. Zwinkelstein, Dr. Risk, and Dr. Salinas, and these individuals on this slide, particularly our faculty advisor, Dr. Tsourkas, without these people's help, this would not be possible. So thank you, and we'd like to open the floor to any questions.